What is the difference between a retraction ring and a Bandel's ring? Let's discuss. When the woman is in first stage of labor, there will be a lot of physiological events. One important event is the uterine contraction and retraction. Contraction means this is a temporary tightening of the uterine muscle fibers. Then retraction means this is an irreversible process. That means after every contraction, what is actually happening, the muscle fibers on the upper portion of the uterus become short, as well as there will be increase in the thickness. Now, with each every contraction and retraction, the uterus is get functionally divided into an upper segment and a lower segment. In upper segment, the muscle fibers are very short but very thick, and they are creating the contractions. While in the lower segment, they are become distending, they are become stretching, they are thin. So at the junction of this upper segment and the lower segment, there will be a ring. So that we called as a retraction ring, or it is also known as physiological ring, because this is a complete physiological process that is indicating a good progress of labor. Usually the ring is not visible. But in case of an obstructed labor, it can be due to causes like any congenital hydrocephalus or cephalopelvic disproportion, or due to some malpresentation. What is actually happening? The normal labor process is not progressing here. So, and because of that, the upper segment is creating vigorous contractions, while the lower segment for the compensation, they are stretching or over distending. And because of that, what happens? The retraction rings start to ascend. Normally, it only ascends at the level of symphysis pubis, and after the delivery of the baby, it will resolve spontaneously. But here in obstructed labor, what is actually happening with every vigorous contraction and retraction, the retraction ring is actually ascending, and sometimes it can come up to the level of umbilicus. It will be palpable, or sometimes it will be visible as a transverse or slight oblique depressed ridge around the abdomen. So this is called as a Bandel's ring. So what is the clinical significance? Remember, this is a pathological process and this is an obstetrical emergency. So the Bandel's ring is a sign of impending uterine rupture. That means the uterus is going to rupture. So now you know.